everyone. My name is Donna Wilson. I'm a clinical nurse specialist and a personal trainer at the Integrative Medicine Center at Memorial Sloan Kettering Cancer Center. I'm also the captain of the first Women Cancer Survivor Dragon Boat team. And today the title is Keep Moving. Whether you, no matter at what point that you have a cancer diagnosis, going through treatment, at the beginning of treatment, during treatment, and as a survivor, we have to keep moving. So the first question I want you all to sit and think about is, what is your fitness level as you watch this? Are you exercising? How often do you exercise? Or, are you not exercising at all? Why and why? And, I don't want you to be fooled by the word exercise, like you have to go to a gym or, you really have to get this membership going. I want you to think about movement, and I want you to think about physical activity, because I want you to keep moving. I can tell you for the last 10 years that I've been a personal trainer at Integrated Medicine, people have come to me after their treatment that they could not literally get out of a chair. That's how weak they were. But because we are changing our mode, that we no longer tell people go home and rest, we want them to keep moving. We want you to, if you're tired one day, to move on the next day and to really sort of get up and movement. And so this could be walking. This could be just, lifting things in the house, going to the store, but not becoming sedentary and becoming, you have to lie down or be in the chair all the time. So the exercise programs that I think about is you could go and, even jog for, 10 steps and then walk, but just something to get your heart rate moving and feeling like you're feeling healthier. Cardio fitness is very key for so many aspects of our life, as we read all the time. So it's important to do it. Or get on a stationary bicycle, or if you are lucky enough to have an elliptical, or stair climbing. How many people, we all have stairs in our home, most of us anyway, or stairs in the building that you live in. But remember, I'm going to go over later how to do the stair climbing so you do not become breathless. Weight training. You think about weights and you think, oh, I don't have any dumbbells. Well, use 2 bottles of water. We all seem to have a bottle of water in our hand. And just to keep the flexibility of the upper body to go. Then some people like to do Pilates or yoga, whatever you prefer. There's also, don't be fooled that you have to do all the fancy things in yoga. There's a type of yoga called restorative yoga that you could just do several movements that are just sort of a stretch to a movement. And of course, stretching. Now, the active lifestyle, I'd like to tell you is that only 50% of our US population actually exercises. And really, the American Cancer Society and the American College of Chest Physicians came out in 2006 that we all, cancer patients, should be exercising 5 times a week for 30 minutes. Well, I know that seems overwhelming, but maybe if we could think about it in a much more simplistic way, I'll try to go through that today. But I want you to not think of the word fitness. I don't want you to think of the word exercise. I want you to think of the word physical activity. But again, there are books now out to really suggest how we all keep moving. So why is it so important to move? Well, to control your weight. How about your bones and your muscles and your joints? Your bones, whether we go through all kinds of cancer treatment, causes osteoporosis. It's very common in women in general, and then with women after breast cancer, or men getting hormone treatment. So we really have to do some weight bearing for that. If we want to be muscular strength, just to do our activities of daily living, we need to be muscle strength. Joints are really a big issue, especially with, again, going to the women after breast cancer with the aromasin inhibitors. If you're on them, they cause joint discomfort. So we want to keep them as flexible and movement as we can. The risk of diabetes and hypertension, as we know, diabetes is a major problem because of obesity in this country. So again, we want to keep really healthy, and we want to keep the blood pressure and the heart healthy and diabetes under control. But I could tell you, if you read one, I can read 10 different research projects that come out all the time, that exercise decreases depression, it decreases anxiety, and it really improves your self-image. There have been very clear reports to show that people that exercise after the diagnosis of breast cancer and colon cancer decrease their recurrence rate. So that's very, very important. Also, there is a link to reducing the risk of breast, lung, and prostate cancers. So again, in every aspect, even, to prevent the risk of a cancer and to get back into a normal lifestyle after cancer, exercise is really a key factor. I'm going to go through a few of the different groups of types of cancer. Just these are the ones that have probably the most research projects that have really illustrated that exercise or physical activity is the way to go. After a breast cancer diagnosis, it's really important that weight gain is really a problem with some of the hormone-sensitive tumors. So therefore, women during chemotherapy and many of them after can gain up to 10 to 15 pounds, which is really, uncomfortable. It's a weight that you're all increasing your size up a few and your clothes don't fit. So it's important, again, for movement. Well, how do we keep that under control? We keep it under control by probably walking, they say, from 3 to 5 hours a week, so we can improve our survival. Again, body image, fatigue, anxiety, and aerobic training now through a really incredible study through NIH with a Catherine Schmidt has shown and proven that if you, in a slow progressive motion and with good form, you can go ahead and do weight training without the risk of lymphedema, which is really a concern for women after breast cancer surgery. If we go to colon cancer, the most important thing is that exercise after the diagnosis and after your treatment is to really get on an exercise program, and the reason for that, it has really illustrated that it decreases recurrence, and that is again because it increases the transit time of your waste products through your body, so therefore it will decrease your risk of colon cancer. Now, there are about 5 or 6 really good positive studies with colon cancer, and all of them have shown that yes, it decreases their level of fatigue after treatment and they improve their muscular strength. But I did put on that there are barriers, and the barriers are that why people don't exercise. And it's really, I hate to say this, but people say, well, they were too busy. They didn't have time to exercise, or they were too tired, or they were just non-specific side effects. Now, I will say the one thing about fatigue right away, which is the most common side effect. I could tell you that when you exercise and do even some light weight training and you start moving your muscles, you actually produce a lot of chemicals in the muscle that actually will decrease the fatigue of the muscle. So when I've taken 2 groups of people, and one that is exercising and one that is not exercising, I could tell you that after 6 or 8 weeks, I illustrate that the women and men that have exercised have really decreased their level of fatigue. I'm not saying it takes it away, but you've really decreased that level. So their level of fatigue may be just 1 or 2, where the person that did not exercise at all is more sedentary, and their level of their fatigue level on a scale of 1 to 10 might be 6 or 7, which is much higher. If we look at lung cancer, it's an interesting thing. We breathe because of the muscles of our chest wall. So when you get the diagnosis of lung cancer, people sort of just freeze. And I think they feel so overwhelmed that, they become very shallow in their breathing pattern. So there has been a great study that came out that people they exercised twice a week for about 8 weeks. They all illustrated that those men and women in that particular group with lung cancer, this is people that were being treated with lung cancer and survivors, that they decreased their level of breathlessness, so therefore they could do more activity and not become breathless. Now, what did they do? They were doing cardio fitness and weight training. So for their cardio fitness, they did walking, or a brisk walking, not just a leisurely like anybody kind of walking down the street. I want to be a New York City really brisk walker. Or you could maybe jog a little bit in between. Or you could do a stationary bicycle or an elliptical, or again, stair climbing. I'll mention right now, and this is the second time I've mentioned stair climbing, because it is a phenomenally good exercise. When you do the stair climbing, I will explain now, is that when you put your whole body on one step, you breathe out as you go up the steps. So you might go breathe out, up as you go, each foot goes on a step, you breathe out. So then when you get to the top of 10 or 12 steps, you do not feel breathless. But it is so important that people with any kind of lung disorder, either from chemotherapy treatment or with lung cancer, that they exercise, because you breathe because of these muscles on your chest wall. If the muscles of your diaphragm, which is a large muscle here under your ribs, if that gets weak, or your muscles of your chest wall get weak, it's really an effort to breathe. So I really, really push people to really exercise and keep as flexible as you can with your upper body. And of course, I didn't mention here swimming, which is a phenomenal exercise. Patients with lymphoma, the same thing. Again, it sounds like a repetitive motion, but I'm purposely doing this to show that research has shown that physical movement, physical activity is most important. This particular program was 12 to 18 weeks long. It was an individualized, supervised program. People exercised in this program for 3 times per week for 30 to 45 minutes. And again, they did muscle training. And again, it showed that they improved their fatigue level, they had less fatigue, and they had less mood disturbances. And most importantly, it had shown that exercise was safe. There was no problem with the exercise during and after their treatment. With prostate cancer, again, it's limited in some of there's several studies, but not as many as the others, that it is safe. Exercise does not affect the PSA, but I will have to speak to all the men that are getting hormone treatment. When they are on hormone treatment, they get a lot of decreasing of their testosterone, therefore they get a lot of muscle wasting and loss of muscle mass. And it has been shown that if you exercise during that treatment, when you're getting your hormone treatment, that you've improved your exercise physical performance. And think about it, if you become very weak all over, everything is an effort. So it's really important from all aspects to really exercise upper and lower body. And also, it did lower, again, there's muscles in all parts of our body. It decreased their incontinence problem, and it also improved their balance. I will say that muscle strength and your balance, it goes hand in hand. The weaker you are, the poorer your balance, okay? And with poor balance, then there's a risk of falling. The risk of falling is the risk of fracture. So, I mean, it's so important, again, for this physical activity. Okay, how do we customize a program? It's really important about thinking about when people come see me, and how do I customize it? I have physician, clearance, of course. I do an assessment. So if I have someone come in and I have not met them before, I will do a step test with them, see how far they can go up and down on a step for 3 minutes. I might do a 6-minute walk test to see how far they can walk within a distance. I may do some flexibility, seeing how flexible they are by sitting them on the floor and just seeing, can they touch their toes, or how far can they actually bend at the hip level and really be more flexible. Once I know from a standpoint of what their cardiac function is on the step test, then we'll go and see how strong they are. I might ask them to lift a heavier weight, just 1 rep, to see what they can do. And then I'll look at their range, especially anyone with upper body surgery, breast, lung cancer, abdominal surgery. we're very much connected from the top of our body to the bottom. I mean, everything's all connected. So I might do range of motion exercises with people to see how far they can get their arm up, to see that, you know, where it is, and how, if they can only move their arm up this far, it alerts me that I have to do a lot of flexibility work with their shoulders. Cardiovascular training, what we'll do is I will, once I see them, I might send them home and say, okay, I want you to walk a half a mile a day or a mile a day or whatever I think that they can fit into their lifestyle. Balance training, again, goes with strength training. So what we'll do is we'll do a lot of leg exercises for, to do some lower body strengthening as well as upper body strengthening. And of course, stretching. Stretching, because once we get the muscles nice and strong, we want to make sure they stay as flexible as we can. Okay, so the goals of what I would suggest for people to do, and this is not just with my opinion and my expertise, is also from the American College of Sports Medicine with the American Cancer Society for cancer survivors, is that we would like to see them exercise 3 to 5 times a week for 30 minutes to do muscular training, weight training, either with resistance bands, the elastic bands, or with weights, anywhere from 1 to 4 times a week. Some flat arm exercises that we could make as flexible as for you is to do them when you wake up in the morning or in the evening, do them for 5 to 6 minutes. And again, most importantly is body composition, and that's weight management. You know, body composition, you know, is another whole subject and is another whole world, and it's really part of the world of nutrition, but really mindful eating is really key factor, and to really eat as healthy as we can, and, you know, try to stay away from, we know what foods are bad, we know what things gain weight. So I'm not going to go into that, but I do want you to be thinking about mindful eating. Okay, now I've gone over all the aspects of why you should move, how, but let's do some movement together. And I'm going to make this really very easy, so no matter who you are, you can do this. But I will add, you know, I work at Memorial Sloan Kettering at Integrated Medicine. You can always call me or email me and ask me any questions you can. The first thing I want you to start with no matter what, you could do it sitting in a chair, or you could be next to the chair so you can lean on it so you can have some stability, but is to just do some breathing. Your lungs go from above your collarbone here to your ribs, and they're large. So I want you to take such a nice big deep breath. So breathe in through your nose. Hold the breath, 1, 2, 3, 4. Now blow it out. Breathe in. Hold the breath and blow out. The next is, as I've mentioned earlier, is that you breathe because of the muscles of your chest wall. So I want you to stretch those muscles to get better expansion of the chest wall. So breathe in. As you breathe in, put your arms up as far as you can. It might be just here, or you might be able to go up here. And breathe out as the arms come down. Breathe in through your nose, and breathe out. Now the next one is putting your arms parallel to the floor, palms forward. Now breathe out first. When you breathe out first, you contract all the muscles of your upper chest, and you're contracting your stomach. Now breathe in through the nose and open that chest. Now blow out and breathe in. Blow out and put your arms down. The last one is called a snow angel. Now again, you can do these in the chair if you're feeling like you're more stable in the chair. You take your hands and you put your palms forward. You spread your fingers apart. And think about it, that we maybe get used to this in the snow, but you breathe out as you put your arms over your head, you breathe out. Then you breathe in as you go down. So again, you're moving all the muscles of your chest, your shoulder, and your back and down. So let's do 2 of those together. Breathe out and down. Breathe out. Now breathe in. Now, interestingly enough, just doing those 6 or 7 breathing exercises, you've already moved stuff in your shoulders. But let's add to a little flexibility for your shoulders and just put your arms out to the side. Put your palms up, put your palms down. So it rotates everything in your shoulder, up and down. All the attachments into the shoulder, up and down. So let's do that 4 times. Up, down, up, down, up, down, up, and down. Now bring your arms straight in, your hands are right in front of your shoulders, and bring your palms up to the ceiling and down. Up and down. 2 more. Up, down, up, and down. Now I'd like to just have you put your fingertips on your ears and just make elbow circles. Again, for the flexibility of your shoulders. 2 and 3 and 4. Now the next is I'd like to just have you do arm circles. You can think about arm circles in any direction because it's really good for the whole shoulder, the upper chest, and the upper back. So anybody with surgery of the torso, it's excellent. So you breathe in and you bring your arm up, turn your hand around and go back down. You could do it in your front of the body. You could do it in the side of the body. Okay, 2 more on this right side. Around and around. Now let's go to the other side. Just go up, bring the arm up, turn your palm to the back and down. Up and back. Excellent. 2 more. Up and back. Up and back. Again, to move everything in your torso, let's do shoulder shrugs. Breathe in, breathe out. Breathe in, breathe out. 2 more. Up and down, up and down. All right, we're going to do some chair squats now, which is a great exercise to strengthen your legs, the front of the leg, the back of the leg, and the buttocks. And the buttocks is the largest muscle we have. So you coordinate your pattern of breathing with the exercise. You breathe in. Now, as you're coming off the chair, you squeeze your buttocks and breathe out. Go back down and breathe in, breathe out, squeeze the buttocks and breathe out. So coordinate, it's almost like a very coordinated motion that you're squeezing your buttocks and breathing out at the same time. So here we go, breathe in, squeeze, breathe out. And one last time is breathe in, squeeze the buttocks and breathe out. Your goal on doing a chair squat would be that I'd love you to do 10 to 20. Start with your goal of 4 to 5, then build up to 10 in repetition. And then eventually you could maybe do 2 sets of 10. It's a phenomenal exercise. At the end of that exercise, you're going to feel your heart rate up. You're going to feel like there's nothing wrong. As you increase your exercise performance, your heart rate will go up, which is a healthy thing. So now you think about weight training. Well, let's think about the legs again. I'm going to stand up, and if you go next to a chair or if you're in the kitchen at the kitchen counter, something that to support you to lean on, and I want you to think about we're going to be contracting your stomach and lifting your legs. Simple, knee lifts. So when you bring your knee up, if you point your toe, you target your stomach and you breathe out. So let's go ahead and do a few of those. So it's and relax. The goal of that is that you should be able to do them eventually without holding on to some stability. And that's getting the legs strong and the abdomen strong. So knee lifts and chair squats are great for the lower body. Now let's sit down in the chair again, because I think anyone that's going to start to do weight training should initially do it sitting in a chair, because you want to support your lower body and stabilize this. And just even if you have to sit back in the chair, it's all right. But even if you make a fisted hand, I'll sit back in the chair to support my back and my abdomen. If you make a fisted hand, when you make that fist, you increase the fiber activation of the muscles of your arm. So if I take my arms and put them up like this and then squeeze my hands together, you're creating some resistance in the muscle. So you breathe out and lift up, 1 and down. Breathe out, 2. We're just going to do 4, 3, and 4. So right now you've done the shoulders, the chest, and the upper back, and that hamstring, the tricep muscle in the back of the arm there. Again, you want to do the bicep muscle. You make a fist and you go up and down. It's not hard to do. So you can really start to keep those muscles nice and strong. The back is a group of very large muscles that we want to keep as strong as we can. So let's go ahead and lean slightly forward from your hips. Your shoulders are back, your arms are in front. We're going to do 4 reps. And you're going to make a squeeze those hands together, make a fisted hand, breathe out and squeeze, 1 and back. And squeeze back, 2, 3, and 4, and down. So right now you've done shoulders, you've done arms and back. And it's that simple. So it's not that you have to go to the gym, or you could do all this in the privacy of your home. The last is you want to think about stretching. And the most important thing is you want to make it easy for yourself. You know, interlace your fingers, turn your hands inside out. You can stretch your back and your arms all at the same time. And you kind of hold that stretch, count to maybe 10, and just hold that stretch and relax. If you want to stretch the back of your legs, come forward on your chair. Take take your right heel and put it into the floor. Lift your chest, push your shoulders back, and bend at the hips so that you can feel the stretch behind the back of the knee. It'll get the hamstring in the back. If you point your toe to the ceiling, it'll try to get the back of your calf. And let's bring that leg in, and let's do the left. Put the heel into the floor, lift the chest, shoulders back, and a slight leaning forward. Your tummy is always tight. And that's it. So how simple, breathing exercises, some arm flexibility, some leg exercises, and some weight training, just even using a fisted hand, a little stretch, and you're done. So that's a great start to keep you moving. Thank you.